My name is Anthony Nadi, and my student ID number is S299583. I'm making a personal presentation on the impact of addictive behavior on health, healthcare access, and society. This is an expansion of what I've already submitted on my slide, which is bullet points. As an introduction, addiction, whether to substances such as alcohol, tobacco, or drugs, or behavior such as gambling, sex, poses a significant challenge to health systems, communities, and individuals worldwide. This personal presentation examines the relationship between addictive behaviors and the social determinants of health, critically analyzes the associated health challenges, and proposes evidence-based solutions that consider the views of diverse stakeholders. In doing so, it aims to explore the root causes of addiction, the complexities surrounding its management, and the strategies needed to address its widespread impact. Social determinants of health. Addictive behaviors are deeply rooted in the social determinants of health, which are the non-medical factors influencing health outcomes. This includes social status, education, employment, neighborhood, environment, and social support network. Addiction cannot be viewed in isolation, but must be understood as a multifaceted problem influenced by structural inequalities. Poverty and inequality. Individuals in lower socio-economic groups are disproportionately affected by addiction. The World Health Organization in 2010 suggests that poverty and social disadvantage increases susceptibility to addictive behaviors due to stress, lack of opportunities, and limited access to supportive services. For example, people in deprived communities are more likely to smoke, misuse alcohol, and use illicit substances. Mammoth at L 2020 confirmed said that. This leads to increased rates of chronic illnesses such as liver disease, cardiovascular conditions, and mental health disorders. Education and illiteracy and health literacy. Low level of education are associated with increased vulnerability to addiction. Health literacy, the ability to understand and use health information, is crucial in preventing and managing addictive behaviors. Studies show that people with limited health literacy are less likely to engage with preventative programs and are more prone to making unhealthy lifestyle choices. Not being 2008 confirmed that. Environment and community influence. The environment plays a significant role in addiction. Urban areas with higher concentration of alcohol outlets or poor policing may contribute to substance misuse. Social norms and peer pressure, particularly among youth, also shape addictive behavior. Communities with weak social cohesion often lack the protective factors needed to buffer individuals from engaging in addiction. Health access and the burden of diseases. People affected by addiction often face barriers to healthcare access, including stigma, discrimination, and financial constraints. This delays diagnosis and treatment, thereby exacerbating disease progression. The burden of disease is thus disproportionately borne by already disadvantaged populations, reinforcing cycles of poor health and poverty. I'm going to expand more on this because in certain communities, for example, let's say the ethnic minorities, or in my community of Nigeria, for example, when people are addicted to substances like drugs, they are often marginalized. They are seen as weak. Nobody likes to associate with them, even their family, and therefore it makes these people difficult. It's almost impossible for them to seek help because they don't want to be seen. Critical analysis of health challenges. Tackling addiction involves addressing multiple interconnected challenges. This range from social and economic complexities to political, legal, and economic and ethical considerations. Okay, an expansion on that. Social and economic challenges. Addiction is both a cause and consequence of social marginalization. Unemployment, homelessness, and family breakdowns often intersect with addiction. Economically, the cost of addiction is vast. In the UK alone, alcohol-related addiction related harm is estimated to cost the NHS 3.5 billion pounds annually. That's according to Public Health England 2018. Substance misuse also increased crime rates and places pressure on housing and social care system. Political and policy dimensions. Public policy plays a vital role in addiction prevention and treatment. However, policies are often shaped by political ideologies rather than evidence. For instance, punitive drug laws have been criticized for disproportionately targeting minority groups and failing to reduce drug misuse, drug consumption, drug misuse. Harm reduction approaches such as supervised drugs consumption room have proven effective but remain politically contentious. Ethical dilemma and stigma. Addiction challenges traditional concept of autonomy and responsibility. Ethical tensions arise around whether individuals should be held accountable for behaviors that may be influenced by neurological challenges. Furthermore, stigma remains a major barrier. People with addiction are often labeled as morally weak or criminal, leading to social exclusion and reluctance to seek help. Livingston et al. 2012. Intersectionality and vulnerability. Certain groups face compounded vulnerability. For example, women with addiction may face gender-based violence or lose custody of their children, while ethnic minorities may face systemic racism within healthcare. These overlapping identities necessitate nuanced, culturally sensitive approach to addiction treatment. Crenshaw, 1991. Proposing solutions. Effective responses to addiction require comprehensive, evidence-based strategies involving diverse stakeholders. Solutions must be preventative, inclusive, adaptable to the need of affected population. Prevention strategies. Prevention is most effective when targeted early and across multiple domains. School-based programs such as the life skills training model have demonstrated success in reducing substance misuse among youths by building personal and social competence. Community initiatives that strengthen social networks and provide safe recreational spaces also reduce risk factors for addiction. Treatment, recovery, and recovery. Addiction treatment should be person-based, person-centered, and holistic. Integrated care models that combine medical, psychological, and social support are the most effective. For example, the use of medication-assisted treatment, MAT, alongside counseling has proven to reduce opioid dependence and related harms. National Institute on Drugs Abuse 2010 to 2020. Harm reduction approaches. Harm reduction recognizes that complete abstinence may not be achievable for all. Needle exchange programs, naloxone distribution, and supervised consumption sites reduce health risks such as HIV and overdose, while offering a pathway to recovery. McNeil et al. 2014. These interventions are cost-effective and endorsed by major public health organizations, including WHO. The role of stakeholders. Government must invest in public health infrastructure, enact progressive policies, and address social inequalities. Healthcare professionals should receive training in addiction medicine and trauma-informed care to reduce stigma and improve patient outcomes. Public health organizations play a key role in community engagement, advocacy, and service delivery. Service users and peer support networks must be included in the co-design of programs to ensure relevance and empowerment. Tackling structural issues. Long-term solutions require addressing this upstream determinant of addiction. This includes reducing income inequality, improving access to education, and creating stable employment opportunities. Policies like minimum unit pricing on alcohol and regulating gambling advertising also helps shift societal norms. Holmes et al. 2014. Conclusion. Addictive behaviors are complex, multifactorial issues deeply embedded in social, economic, and political contexts. To address them effectively, a holistic and interdisciplinary approach is essential. One that acknowledges the role of social determinants, confronts the systemic challenges involved, and proposes inclusive, evidence-based strategies. By involving diverse stakeholders and focusing on both prevention and harm reduction, societies can reduce the burden of addiction and promote healthier, more equitable community. Thank you.